Vanakkam, Namaste, and welcome to Dr. Shah's clinic. In this short video, we're going to discuss on what to do if you see no sperm during ejaculate, or what's wrong with you if you see no sperm or semen coming out at the time of ejaculation. Now, the first common cause of no sperm or semen coming out at the time of ejaculation is erectile dysfunction. Now, erectile dysfunction is a treatable condition. We have to assess what is causing the erectile dysfunction and then treat it appropriately. The second most common cause of no sperm coming out during ejaculation is basically what's called as ejaculatory dysfunction. Now, ejaculatory dysfunction can be because of what's called as retrograde ejaculation. And in individuals with retrograde ejaculation, if you look at the image on the right, semen, instead of coming forward, goes back into the urinary bladder and comes out through the urine. So what happens is, in these individuals, they will have good erection, they will be able to satisfy their partner, they will be able to achieve an orgasm. But during the orgasm, basically what happens is the semen doesn't come forward, it rather goes backward into the urinary bladder, because the internal sphincter, right, it's as marked in the image over there, the internal sphincter does not close for these individuals, right, and then it goes back. Now, why does the internal sphincter does not close? That we have to delve deeper into the topic, and there are many multitude of reasons. So one, the patient can have diabetes mellitus. So if you don't see sperm coming out or semen coming out, what are the things you should check for? You should check for diabetes mellitus. You should check whether you're taking antidepressant medications, right? Now remember, if you're on antidepressants, a large proportion of individuals, almost 67% of individuals, will have either erectile dysfunction or ejaculatory dysfunction, and both these conditions can ultimately lead to no sperm or semen coming out in the at the time of ejaculation. So ejaculatory dysfunction results. So ultimately what happens is the usage of certain medications, the presence of diabetes mellitus in patients with spinal cord injuries, in patients with prosthetic injuries or prosthetic surgeries, large abdominal surgeries that involve resection of the lymph nodes, it's called RP-LND surgeries, and a few other major abdominal surgeries, major pelvic surgeries. All these conditions can ultimately result in ejaculatory dysfunction or no sperm coming out at the time of ejaculation. So what we try to do here is the treatment for this, and this is very important, right? If an individual is diagnosed with no sperm coming out or no semen coming out in the ejaculate, and we know the cause, right? We basically first look at the semen analysis. We try to do a semen analysis. Then we also collect the post-orgasm urine sample. We look at the urine, because the patient may have an orgasm, the semen will go back, it will mix with the urine, and in the urine there will be sperm. So we use a post-orgasmic urine sample, and we look for cloudy white appearance macroscopically and microscopically for the presence of sperm. And what we do is we stop antidepressants and we treat the diabetes. We also give the patient sympathomimetic drugs. We give drugs like midroglycerin hydrochloride, imipramine, and also drugs like cetirizine and chlorpheniramine maleate. So there are a few molecules that we use. And when the patient is given these tablets for a period of say 3 to 6 months, antegrade ejaculation will eventually happen. The treatment success rate in these conditions varies from about say 65% to about 75%. So you have 100 individuals coming to the clinic with this particular condition, 65 to 75 of 100 individuals will get treated. They will achieve normal antegrade ejaculation. So I hope you found this video informative, and if you notice that there's no sperm coming in the ejaculate, what you need to do is visit your andrologist or sexologist near you, rule out diabetes, rule out abdominal surgeries, rule out antidepressant usage, get a thorough check and evaluation. Your hormones has to be assessed, you need a semen analysis, you need a post-orgasm urine sample analysis, and you also need medications with midroglycerin hydrochloride, imipramine, chlorpheniramine maleate, and a few other molecules, and you will achieve antegrade ejaculation. Remember, the ejaculatory dysfunction, which can be caused either by retrograde ejaculation or erectile dysfunction, can lead to infertility, because the semen is not going to be deposited in the vagina, right? If the semen is not going to deposit in the vagina, a child is not going to be born. So you want to get it treated as soon as possible. Hope you found the video informative. Please like, comment, and share, and subscribe to our channel. And see you soon with another video. This is Dr. Shah signing off for now. Bye.